What is ageism and how does it affect the mental health of older adults? Let's get started. I'm Dr. Regina Koepp. I am a clinical geropsychologist and I specialize with older adults and families. I'm also founder and director of the Center for Mental Health and Aging, which is your go-to place online for the mental health care of older adults. So what is ageism? Ageism is bias and discrimination based on age. The American Psychological Association Committee on Aging defines ageism as stereotyping and discrimination against individuals or groups based on their age. It can include prejudicial attitudes, discriminatory practices, or institutional policies and practices that perpetuate stereotypical beliefs. In 2020, researchers identified that ageism cost the United States $63 billion a year and accounts for more than 17 million of 8 of the most expensive medical and mental health conditions, including heart disease, cancer, dementia, diabetes, and mental health conditions, and so many other conditions as well. So ageism can take on many forms. Here's one that you might be aware of: hostile ageism. Hostile ageism is the most aggressive form of ageism, and it's what we see when we observe financial exploitation or physical abuse or sexual abuse of older adults. That's hostile ageism. Then there's neglectful ageism. And neglectful ageism overlooks contributions that older adults are making in society. In the last year, during the COVID pandemic, we focused a lot on how the COVID pandemic was negatively impacting the lives of older adults. And we did not focus enough, in my opinion, on the contributions older adults were making during the pandemic. Dr. Fauci, for example, turned 80 during the pandemic. Also, many of my older friends and neighbors actually retired and had some planned retirement during the pandemic and then began caring for their grandchildren so that their children who were my age could work. So thanks, older adults, for the contributions. All right, and the third is benevolent ageism. Okay, so benevolent ageism is tricky because this suggests that we actually are trying to do something good, but then it actually has the impact of doing some harm. So benevolent ageism shows up in messages like this. During the coronavirus pandemic, I would drive every day to my clinic. It was a mental health outpatient clinic for older adults. And I would drive underneath a freeway sign that said, "Coronavirus, isolate the elderly." Let's break this down. It was benevolent in that it seemed like the intention was to make sure that older adults were protected from harm, not getting exposed to COVID. The downside has multiple layers to it. One of the layers was that it assumed older adults as one uniformly frail and vulnerable group, when that is largely inaccurate. Older adults are incredibly diverse in age and in ability, and span from 65 years old to 122. And within this age group, which is almost 60 years, people have all sorts of medical and mental health vulnerabilities and strengths. Okay, another layer of this sign that revealed some benevolent ageism was that in an effort to protect older adults from the harm of COVID, they put older adults at risk by suggesting isolation. And we know that isolation is incredibly harmful to any person, older adults included. Now let's look at how ageism affects the mental health of older adults. Let's start with dementia. Ageism, research has shown, has been linked to Alzheimer's disease. Several studies have shown that when we have negative views about aging, we're actually more at risk of developing Alzheimer's disease. In a study looking at how ageist beliefs affect older adults with mental health condition, one study found that older adults with ageist beliefs who fully believed ageist beliefs about themselves and about others had higher rates of PTSD, higher thoughts about suicide, and more anxiety at significant levels. And the groups that had positive beliefs about aging, the lowest levels of anxiety, PTSD, that's post-traumatic stress disorder, and suicide. Ageism also shows up in the way older adults are treated related to mental health care. In a 2017 study looking at people who had suicidal ideation in an emergency room, researchers found that older adults were significantly less likely to be evaluated for mental health care when they had suicidal thoughts and to be referred to mental health care when they had suicidal thoughts than their younger counterparts. That's an example of structural ageism where we as a healthcare system have to do better. So you see, our beliefs about ourselves related to age and others' beliefs about us, even in the healthcare system, really deeply influence mental health for older adults. So what can we do about it? The first is to be self-aware. Where is ageism showing up in your mind and in your life? And how are you challenging ageist thoughts when they do show up? To deepen your understanding of your own ageist thoughts, there's the Harvard Implicit Associations test, where you can look at your own assumptions and biases about older adults. It's anonymous and it's just for you, so give it a try. You can also do what I like to call shifting your focus. You can shift from a stereotypical view of older adults being all alike and frail to a counter stereotype. This is where you put a picture in your mind of an older adult who is counter to what the stereotype would say. So here's an example. When I am working long hours in mental health care with people who are very medically vulnerable or at the end of their life, my view becomes very narrow about aging, right? I see older adults who are very ill and nearing the end of their life. And so I have to make a concerted effort to shift my focus so that I see all of the older adults around me, not just the older adults who are experiencing very extreme medical and mental health conditions. I have to shift my focus, broaden my lens, so I include other older adults who are thriving and at other stages in their aging. If you're a caregiver, this could be helpful. This strategy could be helpful. What I hear from caregivers is, I'm so afraid that I'm going to get the condition that my loved one has. Of course you're afraid. Of course you're dreading that. You see it every day. And that is a very narrow focus. Remember that study that if you're caring for a loved one with dementia, even if you have the Alzheimer's gene, just shifting the way you think about aging could help. So broaden your focus and see other older adults around you who aren't necessarily needing of care. And so that you could imagine what your future might look like as an older adult too. And also, thank you for what you're doing with caregiving. I want to leave you with one final important statistic. Older adults with a positive view of aging live 7.5 years longer than adults with negative views of aging. 7.5 years longer. And based on the mental health research, probably happier too. What influences our belief about aging and ageism? Others' beliefs about us and our beliefs about ourselves. If we all make an effort to begin to shift what it means to grow older and to dismantle some of this ageism, the world will be a healthier and happier place. If you'd like to dive deeper about ageism and mental health, head on over to the podcast where I have a more in-depth episode all about ageism and mental health. I'll see you there.